friend, and I'll be doing an assessment of your head, face, and neck today, okay?
Okay.
Alright, well first I just want to verify your name and your date of birth, and I've got that your name is John Doe, date of birth 4/26/1990. Is that correct?
Yes.
Okay. Well, I've washed and sanitized my hands, and I've got my gloves on, but before I begin, I just want to ask you a few questions that pertain to the assessment, okay?
Okay.
Alright. Have you ever had any history of problems with your thyroid, like hyper or hypothyroidism?
No.
Okay? And have you ever had any history of trauma to your head or to your neck that you're aware of?
No.
Okay, good. Alright, well first I'm going to start with your head. If you will, just kind of keep your head immobile and upright for me.
Okay.
But your head appears normocephalic. It's in proportion to the rest of your body. It's midline. It appears round, but I'm just going to feel it really quick, okay, and palpate your head.
Okay.
Okay. And your head feels smooth. I don't feel any lesions or lumps, no bony prominences or masses. And I don't see any infestations, no deformities, okay?
Okay.
Alright, next I'm going to move on to your face. Your face appears symmetric. I don't see any involuntary movements or anything like that. But what I want to do is just test your cranial nerve number 7, which is your facial nerve, okay?
Okay.
So, if you will, I just want you to smile really big, okay? And hold that smile as I press against your cheeks, okay? Good. Alright, now I want you to raise your eyebrows. Good. And the wrinkles on your forehead appear to be symmetric, so that's normal. And I also want you to blow air in your mouth or puff up your cheeks. Alright, and hold that as I press against your cheeks. Good. So your cranial nerve number 7 appears to be normal. Now I'm just going to feel the skin on your face, okay?
Okay.
Alright. And your skin feels smooth, it feels dry. And what I want to do now is just palpate your temporal artery, okay?
Alright.
Alright. And is there any pain as I palpate this area?
No.
Okay, so it's non-tender. This artery feels elastic, and I do feel normal pulsations in that artery, so that's normal. Okay? Alright, now I want to test your cranial nerve number 5, or your trigeminal nerve. This will test your masseter and your temporal muscles, okay?
Okay.
So what I want you to do is clench your teeth. Good, and let go. And again. Good. So as you do that, I feel contraction of both your masseter and your temporal muscles, so that's normal, okay? Now I also want to do something else to test your cranial nerve number 5. I'm going to test the sensations of your face, okay?
Okay.
Alright? So I'm going to touch you with a dull side and a sharp side of this paper clip. And I want you to tell me if it's dull or sharp, and where I'm touching you at.
Okay.
And when I'm touching you, okay?
You're touching me above my left eye and it's sharp.
Okay.
You're touching me above my right eye and it's dull.
Okay.
You're touching me on my right cheek and it's sharp.
Okay.
You're touching me on my left cheek and it's sharp.
Alright, good. And one more.
You're touching me on my chin and it's dull.
Good. Okay. So your trigeminal nerve appears to be normal. Now what I want to do is palpate your TMJ, okay, which is your temporomandibular joint. Alright, so what I want you to do is open your mouth wide and close it. Good. And do you have any pain when you do that?
No.
Alright. And I don't feel any crepitus or any inflammation to that area. Alright. Next, what I want you to do is open your mouth as wide as you can.
Okay.
Alright. I'm just going to measure from your upper teeth to your lower teeth, and I note that it's about 4 centimeters, which is normal. And I want you to move your bottom of your mouth laterally from side to side. Good. And you do have full range of motion of that, and you're moving it about 1 to 2 centimeters in each direction, which is normal. Alright. Next, I'm going to move on to your neck.
Okay.
Let's see. If you will, just slightly extend your neck. Alright. And your neck appears to be midline. I don't see any obvious swelling or masses. But what I want to do is just feel of your thyroid and your cricoid cartilage along with your thyroid gland. So if you will, I want you to extend your neck and take a swallow of water. Good. So as you're you're doing that, both your cricoid and your thyroid cartilage moves upward symmetrically. And I don't palpate your thyroid gland, which is normal. Okay? Alright. Next, I'm going to palpate your trachea. If you'll just extend your neck again. Alright. And I note that your trachea is midline and there's no deviation. Alright. Next, I'm going to palpate your C7. So if you will, flex your neck. Alright, I do note that your C7 is prominent and I'm able to palpate it. Is there any tenderness in that area?
No, ma'am.
Okay. Alright, good. Next, I want you to turn your neck from side to side, touch your ear to your shoulder, all the way. And then I want you to flex your neck and extend your neck. Okay. And do you have any pain, stiffness, or rigidity when you do that?
I do not.
Alright, good. So next what I want to do is just palpate your lymph nodes, okay?
Okay.
Alright. Alright, first I'm doing your pre-auricular. Next is post-auricular. Occipital. Tonsillar. Submandibular. Submental. Superficial cervical. Deep cervical. Posterior cervical, and supraclavicular. Alright, and all of those do feel mobile. Do you have any tenderness when I palpate those?
No, ma'am.
Alright, so they're non-tender, and they appear to be normal or feel normal in size, okay?
Okay.
Alright, lastly, I just want to check your cranial nerve 11, which is your accessory spinal nerve. So if you will, I just want you to turn your head in each direction as I apply pressure against it, okay?
Okay.
Good. Again. Good. Now I want you to shrug your shoulders as I apply pressure.
Okay.
Okay? Alright. Good. Alright, so your accessory spinal nerve appears to be normal. And that concludes my assessment of your head, face, and neck today. Do you have any questions?
No, ma'am.
Alright, thank you.
Thank you.